Hey guys, Dr. Farley here. So I have done this video before, but it was several years ago. And I had a couple patients tell me that they specifically watched this and it helped them notice things on their skin, and they went in and were seen and found that they actually had skin cancers that needed to be removed. So if you forget everything I say in the next 2 minutes, just remember the ugly duckling sign. If you have something on your skin that doesn't look like any of the other friends on your skin, then it probably needs to be checked out by a physician. But there are 3 types of skin cancer. The most common type of skin cancer is called basal cell carcinoma. So basal cell skin cancer is going to be our slowest growing type of skin cancer. It is also a skin cancer that does not metastasize. It is just locally invasive. It is typically removed with a procedure called Mohs if it is more advanced stage. A lot of times, however, though, we can do just a local excision of it, and if we get it all, then you don't need to go back for more removal. With basal cell carcinomas, they do come most of the time from sun exposure. They are pretty recognizable because they typically grow outward off of the skin, so most patients will notice them and bring them to their physician's attention. The second type of skin cancer is squamous cell carcinoma. This type of skin cancer can metastasize and can be a little bit more aggressive. We do see it again from sun exposure. We also see it a lot from cigarette smoke exposure. Now, this type of cancer usually presents as a precancerous lesion that we call an actinic keratoses, and those are going to be a red spot that's kind of flaky. It may come and go. When it's at that stage, it can be treated with cryotherapy or freezing, which damages that tissue and makes it come off. If it's more advanced stages, it would be sent for something like Mohs, as we discussed with basal cell carcinoma. Those squamous cell carcinomas are a little bit harder to see, but if you have any red, scaly, flaky spots, definitely recommend going to the doctor, or if you have any spots that are coming and going and bleeding, those are definitely areas that need to be observed. And the third type of skin cancer is going to be the melanomas. Those are the ones that people worry about the most. Most melanomas are caused from sun exposure. However, there are some that are not, which are going to be our lenticular melanomas. But most typical types of melanomas we see are called superficial spreading. They are flat, you cannot feel them. They spread outward. They are typically black or multiple colors, or have areas of white with darker brown and black areas in the middle. They typically have irregular borders. They are a little bit harder to spot because they're flat, so people might not notice them that often, but again, they're going to look very different from the other types of typical freckles and moles that you have on your skin. So if you have anything that looks different, very dark, multiple colors, or changing, that's something to get looked at. And the final tip here is that 80% of skin cancers are going to come from a new lesion, not something that is very old and that has changed. So if you have had this mole for the past 25 years and it just looks like it's getting a little bit bigger, that is going to be less likely a cancer than a new spot that showed up maybe on your neck that you just noticed when you were doing your hair or makeup that hasn't been there before. So I hope that was helpful for most of you on our skin cancer talk. But remember, ugly duckling sign, if you don't remember anything else I just said. Have a great day.